And how is the road to recovery after the surgery?
So specific to inguinal hernia repair, if you really have to sort of step back and look at the historic perspective here, because that really, I always start with telling patients how hernias used to be operated on, what the recovery was, and what it is today. It's interesting, I had a patient today who had his hernia repair done in 1960, and he remembered exactly what he went through. He had a large scar to show me, and he remembered that he spent 5 days in a hospital for an inguinal hernia repair, something that is really quite rare or unheard of in today's medicine. So in the olden days, hernia repairs were done using an open approach, which meant that the incision was at least 3-4 inches long. It was painful, and as a result, patients would come in the day before and spend a few days in the hospital and spend up to 6 weeks recovering from just having had a hernia repair. A seismic change that occurred for us was in the mid-1980s. Actually, down in Southern California, there was one of the first surgeons who proposed the idea of performing a tension-free hernia repair, which was in contrast to the older techniques where your own native tissue was used to bridge the gap where hernia occurred. Surgeons would suture tissue over and try to kind of bridge the gap and fix the hernia that way. Part of the reason that procedure, the olden technique, was very painful was because of the tension that was placed on the tissues. But more importantly, that older technique was associated with a high recurrence rate, as high as 30 to 40% of patients who had open tissue repair or anatomic repair would end up with yet another hernia, which is why I had my patient today in my office. His hernia has now recurred. So the change I was referring to was in the mid-80s when the tension-free repair came into consciousness, and that's when use of a prosthetic mesh became the standard of care so that we can reduce chance of recurrence of a hernia and be able to also minimize pain. And of course, along those lines, the next big step in hernia surgery was in the early 90s when we introduced laparoscopic surgery, and that was a giant leap again because not only we were using a tension-free concept and having less pain as a result of that, we almost got rid of that big incision that went through layers and layers and used a laparoscopic or minimally invasive approach to that operation, and I can expand on that. So laparoscopic surgery is a concept. It's where we can avoid big incisions and get into the cavity of interest with very small incisions. If you look at the model I have here next to me, this is a model of an abdominal cavity, and so you just have to use your imagination, groin being at the other end and having a hernia sticking through the abdominal muscles. Instead of making an incision and gaining access to the hernia site, we can place trocars or plastic sheets that are even smaller than what you see here sometimes. And with 2 or 3 of them, we can gain access via a telescope and long instruments such as this, and gain access to the area of interest, perform the whole operation without opening the muscles, and essentially repair the hernia without having done the classic cut and sew technology, which is part of the reason patients have pain.